Your heart skips, flutters, or thumps harder than it should. And in that exact moment, your attention narrows to just one thing. What the heck is going on? Today, we're going to slow this down and talk about what heart palpitations really are and why they're usually harmless and when they deserve attention. This channel is for men over 40 who want straight answers about what their body's doing. If that's for you, you're in the right place. Hey, I'm Nurse Healy. I've been a registered nurse since before the 2000s. I built this channel because you deserve better than what our healthcare has become. Now, before we get into today's topic, let's answer something that came in this week from a guy by the name of Mark. He says, I haven't been to the doctor in years because I'm scared of what they'll find. Am I abnormal? And how do I get over that fear? Well, Mark, you're certainly not alone, and I've heard this plenty of times. The fear you speak of is a name called, well, it's called health anxiety or white coat syndrome. Your brain is trying to protect you, but here's the truth. The not knowing is usually scarier than the knowing. If something is going on, would you rather find out now when you have options or later when you don't? After decades in healthcare, I can tell you this. Doctors aren't waiting to give you bad news. Look at an appointment is nothing more than a conversation. There's vital signs and questions. It's a starting point. So here's your move. Book it before you overthink it. Write your worries down if you need to and hand them over. Give them to the doc. Look, taking care of yourself is responsible. Go, make the call, Mark. Now, let's talk about today's episode, where we're talking about symptoms that generate hesitation and sometimes fear, heart palpitations. The sensation feels very dramatic, even when the cause isn't dangerous. Understanding the difference gives you back your control. So, a palpitation is not a diagnosis, it's a sensation that you feel right here, right? An awareness of your heartbeat. It feels like it's skipping or maybe fluttering, pounding, maybe racing, or a brief pause, followed by maybe a strong beat. Most palpitations are caused by changes in the cardiac rhythm itself, not damage, and many happen in completely healthy hearts. Let's start with the most common, non dangerous causes. These are extremely common, which are stress and anxiety, caffeine, poor sleep, if you're dehydrated, nicotine use, any sudden adrenaline surges for something that's happened, any hormonal shifts, or anxiety or exercise recovery. And premature beats, what are called PACs or PVCs, these extra beats are incredibly common. Most people have them, many just don't feel them. They're often more noticeable when you're resting or at night, when you're paying closer attention to your body. Uncomfortable? Sometimes. Dangerous? Usually not. And some medications and supplements can also contribute. So these would include decongestants and stimulants. Here's the trap. You feel a palpitation and your brain interprets danger, right? Your adrenaline increases, your heart responds. The sensation intensifies. This feedback loop is powerful. Anxiety doesn't create heart disease, but it can dramatically amplify normal heart sensations, which is why reassurance and understanding really matters. Now, this part is very important. Palpitations should always be evaluated if they're accompanied by any of these. So, if there's any chest pain or pressure, or there's shortness of breath, dizziness, or any lightheadedness, fainting or near fainting, a sustained rapid heartbeat at rest, or any nuance at a rapid heartbeat without any clear trigger. Oh, and this one's big, a history of heart disease. These don't automatically mean something serious is going on, but they do mean don't ignore it. So context matters more than fear. And one clear line. If you have palpitations plus chest pressure or severe shortness of breath, if you've passed out, you need to treat this as urgent. When palpitations are investigated, it's often straightforward and reassuring. There'd be a physical exam, some blood work, and an EKG. Sometimes we'll order a Holter monitor or an event monitor, but most results come back normal or benign. The goal isn't to find danger, it's to rule it out. And if you really want to make this appointment more useful, you need to track this for about a week. So the events, what time they're happening, and how long they last. What were you doing just before it? And what were your caffeine, alcohol, nicotine for that day? How was your sleep the night before? Any chest pain or breathlessness, dizziness, or sweating? Because these patterns are often the missing piece that a doctor or physician or whomever might be looking for. If palpitations are frequent but mild, reduce caffeine and stimulants, prioritize your sleep, and stay hydrated. Manage stress deliberately and notice patterns rather than catastrophizing sensations, if that makes sense. Your heart is responsive. That's not a flaw, it's a signal system. So, heart palpitations feel alarming because your heart feels personal, but most are messages, not emergencies. The information contained within this video does not provide personal medical advice, diagnosis, or any form of treatments, and should not replace consultation with your own personal healthcare provider. Hey, I'm here to help you understand your health, not to scare you, sell you, or promise any miracles. Just truth and a steady hand. It's time. As always, it keeps its own schedule. Thank you for being here, and thank you for trusting me with your time. If there's something you've been quietly wondering about, you can ask it below. You're no doubt not the only one thinking it.